Assalamualaikum and good day. Welcome to my class. Today topic is
So,
principles reimbursement in healthcare.
this is the learning outcome. So at the end of the lecture, the student will understand the concept of healthcare reimbursement methodology. Second, voluntary healthcare insurance plans. Third is government sponsor healthcare program. And the last one is managed care plus. Okay, so we go to the first part. First part, we will talk about the healthcare reimbursement methodologies. Okay, so kita dengar dia punya keywords ya. Reimbursement methodology. Reimbursement methodology. Okay. So mungkin ada yang confused. What is reimbursement? Reimbursement means apa? Dia lebih kurang macam insurance tau. Okay, hari ni we will learn about insurance. Okay. So reimbursement ni lebih kepada insurance. Okay. So in definition, reimbursement for healthcare service is dependent upon patient having health insurance. So insurance is a system of reducing a person exposure to risk a loss by having another party assume the risk. So in healthcare, the risk the healthcare insurance company assume is the unknown cost of healthcare for a person or group of person. However, the insurance company that assume the risk reduce its own risk by distributing the risk among a larger group of person. This group of person has similar risk of loss and is known as a risk pool. In healthcare, the variability of health status across many people allow the healthcare insurance company to make a better estimate of the average cost of healthcare. So through the company, it receives a premium payment in return for assuming the insurance exposure to risk of loss. So the premium payment for all the insured in the group are pooled. Insurers use actuarial data to calculate the premiums so that the pool is sufficiently large to pay loss of the entire group. So those specific healthcare, the risk is the potential that a person will get sick or require health service and will accrue bills associated with his or her treatment or services. So the premium payment for health insurance are calculated to pay all the potential covered healthcare costs for an entire group of patients. Okay, so this is the characteristic of reimbursement methodology. Okay, there are three different characteristics. First is unit of payment. So unit of payment we can call as an element that is the basis of payment. Second is time orientation. So time orientation is based on retrospective or prospective. And the last characteristic is degree of financial risk. It depends on the level of uncertainty. Okay, so basically there are two major types. Of the reimbursement methodologies. Dia ada dua cara tau. First is healthcare reimbursement methodologies. Second is episode of care reimbursement. Okay. Sorry. First is fee for service. Salah. Dia punya first type fee for service. Okay. Fee for service is actually basically is a self-pay. Okay. It's a traditional respective payment and managed care. For episode of care, it's a capital payment, it's global payment, and prospective payment. Okay. For the self-pay, basically, self-pay is a popular term for a person who pay out pocket for a health-related service in absence of insurance to cover medical or surgical procedure performed. So it needs guarantor, situation for self-pay and self-insured plan. Okay. For traditional prospective payment, basically is a method of reimbursement pay provider after service has been rendered. Prospective reimbursement is a type of fee for services because the provider are reimbursed for e-service rendered. Third party pay reimburse provider for costs or charge previously incurred. Okay. Next is managed care. So term managed care is used in US. It describes a group of activity intended to reduce the cost of providing for-profit healthcare and providing American health insurance while improving the quality of that care. Okay, so there is a drawback, kelemahan for fee for service. Okay, so generally in fee for services, provider are reimbursed for each service they provide. So in fee for service environment, the more services a provider render, the more reimbursement the provider receive. Okay. So some expert contend that fee for service reimbursement inappropriately inflates the cost of healthcare because the payment method rewards provider for more services, whether or not these services are warranted. Okay. For episode of care reimbursement. So in definition, in contrast to traditional fee for service reimbursement where provider are paid separately for each service, an episode of care payment cover all the care a patient receive in the course of treatment for a specific illness, condition, or medical event. So decryption in particular, heart condition or illness, period of relatively continuous care from a provider. Okay. So next is capital payment method. Okay. So capital payment method is basically is one of a kind technique in episode of care reimbursement. Okay. So basically, capital is a fixed amount type of healthcare payment system. So it's used by physician, physician, or insured to pay hospital or doctor per enrolled patient for a specific amount of time. So capitation payments are designed to lower the high cost of healthcare. So it can be a per member per month. So basically there are advantage and disadvantage itself. Okay. So next type of the episode of K investment is a global payment method. So in global payment method is basically combine a fixed prepayment made to a group of provider or a healthcare system. So basically it cover most or all of a patient care during specific time period. Okay. So next is prospective payment method. Okay, so basically it refers to a fixed healthcare payment system. Okay, so this basis on the operating and capital related cost of medical diagnosis and determines reimbursement for care provided. So it is intended to motivate healthcare provider to structure cost-effective, efficient patient care that avoid unnecessary service. So the goal is to provide quality patient care that engage patient and strive for faster diagnosis and treatment, shorter hospital stay, and lower costs. Okay, so this is the drawback for episode of care reimbursement. So basically, the impact of the cash-based payment method is that it's reward effective and efficient delivery of health service and penalize ineffective in efficient delivery. So the cash-based payment rate are based on the average of cost for patient within the group. So generally, the cost for provider that treat patient efficiently and effectively are beneath the average cost. So the provider make money in this situation. On other hand, provider that typically exceed average cost lose money. Inefficient include duplicate laboratory works, scheduling delay, and loss report. Many healthcare organizations have implemented procedure to streamline the delivery of health service to offset inefficiency. So poor clinical diagnosis skill are an example in ineffectiveness. Thus, the more efficiently and effectively a provider delivers care, the greater the provider delivery care, the greater the operator margin will be. So some consumer advocate had voiced concern about episode of care investment. Okay. So this is the things about the drawbacks for the episode of care reimbursement. Okay. So next part, we go to the second part, which is voluntary healthcare insurance plan. Okay. So basically, before we go in deep, so let we go to the definition. So basically, voluntary health insurance scheme is used where the decision to join and the payment of primary or voluntary. So together out of pocket payments, the premium are considered a private revenue source. So many different form of voluntary health insurance exist, from employer-based for profit scheme to small non-profit schemes such as community-based health insurance. Okay. So in voluntary healthcare insurance, which is referred to fee for service, we need to have a grantor and freedom of choice. Okay. So there are type of voluntary healthcare insurance. So umbrella term for two major categories, three classified and one minor category. Okay. So for the commercial healthcare insurance plan, so it can be a private employer based. Third is Blue Cross and Blue Shield plan. Okay. And the minor category is such as a state healthcare plans for medically uninsured. Okay. So this is a confusing terminology. Private means is synonym for commercial insurance. Okay. So it can be a purchase for self and or family rather than for a group of employee or member of an association. Meanwhile, individual use a two-way, not a group and no dependent. Okay. For private healthcare insurance plan, so basically there are two types. First is by private, which is individual. Second in employer based. So for private, basically it bought for individual. Okay. Meanwhile, for employer based, it purchased by employer for a group of employee. Ini biasalah kalau misalnya let's say kalau kita dah bekerja dekat company kan. So selalunya company dia akan ni selalunya maintenance company dia akan ada lah insurance dia akan purchase untuk satu satu bulan semua pekerja dia. Okay. So for private type, I mean private individual healthcare plans, so it refers to any healthcare insurance coverage that is offered by a private entity instead of a state or federal government. So insurance brokers and company both fall into this category. Employer-based healthcare plans. So in definition, employer-based health insurance that is purchased by employer for their employees and financed through employer or joint employee is currently subsidized in part by the federal government through the tax exclusion for employer contribution to employee health insurance plans. Okay. So Blue Cross Blue Shield Association. So basically, it's a federation of 36 separate united state health insurance company that provide health insurance in the United States to more than 106 million people. So basically, it was formed in 1982 from the merger of its two namesake organization, which is Blue Cross. Okay, and then the Blue Cross basically it became the association in 1960. Okay, so why Blue Shield emerged in 1969 and why Blue Shield Association it was created in 1948. Okay, so this one is a history about the Blue Cross and Blue Shield. So basically, what I can say is basically Blue Cross and Blue Shield is coming from the from the US country. Okay, and then usually most of the people, I mean most of the apa ni, community in the world, they are preferring or using this kind of the model from Blue Cross and Blue Shield plan. Model ni agak popular lah. Sebab diorang ni adalah antara pioneer yang membuatkan membuat apa ni insurans ni. Okay. So the section of healthcare insurance policy. You pernah dengar tak healthcare insurance policy? Okay. So basically, kalau if you purchase insurance, there is a policy tau. So policy ni basically is like a contract between provider dengan individual. I mean in the party insurance provider apa ni person which is user. Okay, so dalam in the contract they are also talking about the how the insurance will be billed, annually ke, manually ke, maximum claim ke, dan semua sebagainya. So before you want to purchase a healthcare insurance, you need to read a contract first. Dia tak boleh macam saya cakap, sebab kontrak itulah yang menunjukkan hitam putih suatu insurans tu. Okay, dia tak macam yelah, kalau kita tengok je insurans ni kan, bila kita macam contoh, let's say kalau kita selalu kat mana, bila macam kita perlukan insurans ke apa, dia akan cakap manis je, semuanya okey, semua boleh claim, semua okey, tapi lalas tak boleh claim. Actually, benda tu, you kena take a look dekat dia punya kontrak dia. Kontrak dia akan mencerita perkara yang sebenarnya. So that's why, if you want to purchase suatu insurans ke apa ke, you kena baca polisi tu. Okay? So this is the things yang apa dalam healthcare insurance policy. Dia ada banyak benda. Dia macam ada capitation. Dia ada formulary. The list of drug that insurance plans agrees to cover. Contohnya macam ni kan. Dia ada formula dia. Dia ada explanation of benefit. Okay. Kan? Explanation of benefit. So ada banyak. Capitation. Okay. So capitation basically is an amount paid by the insurance healthcare provider. Let's say kalau misal you hilang anggota badan, kan. So future trends. So it can increase private healthcare costs. So consumer directed healthcare plan. So a value-based insurance design and also is proactive payment system for non-Medicare population. Okay, so now next we go to the part 3, which is government sponsor healthcare program. Ini jarang terdengar. Okay, so basically in this program, it used to differentiate among to identify the various government-sponsored healthcare program, and also it to understand the history of the Medicare and Medicaid program in America, and then to recognize the impact that government-sponsored healthcare program to have on the American healthcare system. So first is Medicare. So basically Medicare ni, yang ni saya cerita pasal yang benda yang dekat US. Okay, so Medicare ni basically is under Social Security Act, and it was implemented on 1966. Okay, so it benefit for the 65 holder. Okay, there are two parts in this Medicare punya package. Okay, satu is one is the hospitalization insurance, second is voluntary supplemental medical insurance. So for part A, it cover inpatient hospital, long-term care. So it have a skilled nursing services. It also provide home health services and also have a hospice care, hospital care. And then for part B, it have a physician, medical services and also supply. Okay. Oh, dia ada juga part C and D juga tau. Part C cover for the Medicare Advantage. And then part D cover for the Medicare drug benefit. Okay. So in Medicaid also, it focus on the individual and family with low income and limited financial resource. It's basically joint program between federal government and state and administered by individual states. Okay. And of course, for Medicaid, it requires coverage for low income family with children, including temporary assistance for needy families, and supplemental security income repayment, and then infant born to Medicaid eligible pregnant women. So children under the age of 6 weeks whose family income is at or below 130% of the federal poverty level. So reception of adoption assistance and foster care is certain Medicare beneficiary and special protected groups. Okay. So this is a temporary assistance for needy family. Okay. So this is for yang ni nama kita panggil sebagai TANF. Okay, TANF. Okay, so Ini adalah antara contoh insurans yang lain lah yang ada dekat US. Okay, temporary assistance for needy family. So basically, this kind of the insurance is under Act 1966, which is the Personal Responsibility and Work Opportunity Reconciliation Act. Okay, this is under welfare reform. So basically, it provides state with grant money designed to provide low-income family with assistance. So basically, it replaces aid to family with dependent children, which is AFDC. Okay. Next is PACE. PACE means Program for All Inclusive Care for Elderly. This program is under Balanced Budget Act 1997. Okay, BBA. So basically, it joined Medicare, Medicaid venture. It offers state the option of creating and administering a managed care option for frail elderly in the population. It also enhances the quality of life for fairly elderly population. Okay. Next is SC SHIP, which is we can call a state children health insurance program. Okay. So basically, it's under title AXI of Social Security Act. Okay. So basically, it's cover children who are not eligible for Medicaid service. Okay. Next is TRICARE. Okay. TRICARE is basically a formally champion civilian health and medical program uninformed services. So basically, it's an active duty member of military and qualified family member. So activated guard or reserve member. So there are three options. First, a 3K prime and prime remote. Okay. Second, 3K extra. Third, 3K standard, and the last one is 3K for life. Okay. Next is CHAMVA. CHAMVA stands for Civilian Health and Medical Program Veteran Administration. Okay, so basically it used for dependent and survivor of disabled veteran. So survivor of veteran who die of service-related condition, survivors of military personnel who die in the line of duty, and next is treated for free at participating VA healthcare facility. Okay. Next, Indian Health Service. Okay, so this is for American Indians. So Alifka native lah. Okay, so yang ni yang dia cover. It covers preventive health service, primary medical service, community health service, substance abuse treatment service, and rehabilitative services. Okay. Next is worker compensation. Okay, so worker compensation, so basically focus on the work-related injuries. It cover healthcare costs for lost income, and also illegalized by individual state, which is we need to set the coverage and it can exclude certain workers. Okay, so worker compensation basically is under the Federal Employee Compensation Act. Okay, it established in 1916 and it's by Office of Worker Compensation Program. Okay, so yang ni dia punya ni lebih fokus kepada worker compensation. Dia kalau dekat Malaysia ni apa orang panggil? Kalau insurans yang dekat Malaysia ni saya lupa lah. Yang untuk cover ni worker ni. Sekejap saya tengok Google, saya lupa pula nama dia. Pekeso. Saya lupa. Pekeso. Okay, kalau kat Malaysia kita panggil pekeso lah. Pernah dengar pekeso? Pernah dengar pekeso tak?
Yes, pernah.
Okay. Pernah dengar pekeso. Pekeso ni selalunya kalau misalnya let's say kalau you dah kerja swasta, you akan dapat pekeso lah. Kalau kerajaan, pekeso ni ada. Rasanya tak ada kot. Kerajaan dia tak ada pekeso. Okay. Actually kan, kalau misalnya you kerja dekat, satu the best thing awak bila kerja dekat swasta ni, dia punya healthcare dia terjaga sikit dia punya ni insurans dia. You boleh Tak adalah macam kita nak claim sana, claim sini. Tapi macam mana kak? Kita lebih selamatlah, terjaga. Sebab kita tak perlu risau pasal contoh let's say kan, you ada macam, yelah kita kerja ni sebenarnya untuk jangka masa yang lama kan. And then kita tak perlu nak risau. Contoh let's say kalau bila dah umur dah naik sikit, dia macam ada selalu sakit kaki apa semua kan. So yang tu kadang-kadang kena buat operation apa semua kan. So benda tu mana nak dapat duit? Apa ni lah cover. Daripada benda-benda macam ni lah. Okay. Okay, so kita pergi ke last sekali. Manage care plans. Okay. Lepas habis ni kita akan rehat sekejap. Kita rehat sekejap. Lepas tu kita akan ni lah. Sebab ada nak sembahyang maghrib Nak sembahyang maghrib. Lepas tu after that kita akan pergi kepada lab terus So manage care plans. So basically manage care systemically merge clinical, financial and administrative process to manage access, cost and quality of healthcare. So the purpose is to provide affordable, high quality healthcare. So this is the history of managed care. This starting from 1910. Okay. We have a Western clinic. Lepas tu kita ada first Blue Cross plan in Dallas. Kaiser Construction Healthcare Plan for Worker. After that, dia ada keluarkan satu act, HMO Act. Kan? So lepas tu ada growth and development lah. Okay. So the benefit and services. So it have a many kind of the category, which is first physician services. Okay. Inpatient services. Preventive care and wellness. Prenatal care. Okay. Emergency services. Diagnostics and laboratory tests. Home health services. Access to mental and behavioral health. Okay. So there are character of managed care. Okay. So the selection criteria for provider. So delivery of continuum of care to population including health and wellness management. Okay. So the quality assessment and improvement, it includes performance improvement activity, NCQA, URSC, CHEPS, HEDIS, member satisfaction. Okay. For service management tools, it have medical necessity review, utilization management, case management, prescription management. And then for episode of care reimbursement, it have a capital reimbursement, global payment. And the last one is financial incentive. Okay. Okay, sekarang ni kita akan masuk kepada integrated delivery system. Okay, so what is IDS? Okay, IDS basically is a integrated delivery network ataupun integrated delivery system, or we can call it a integrated delivery network. It's basically a help system with the goal of logical integration of delivery of healthcare as opposed as to a fragmented system or like a system. Okay. So maksudnya kan sistem dia untuk deliver hub services. Itu masuk IDS. So basically it based on the collaborative integration of care provide to deliver care to population across the continuums. Okay. So there are many types of the SDS. Okay. First is hospital lead. Second is physician lead. Third is physician hospital organization, and last one insurance leads. So the model in the ISDS is such as an integrated provider organization, group practice without walls, physician hospital organization, management service organization. Okay. Okay, so for the future trend, it have access and utilization. Okay. So kita boleh pergi dekat ni video reference. Okay. Kita tengok video dulu boleh.